lot. It's been a full evening already, and we are not finished. We have much more to discuss. This is a really important topic, and it's actually extremely interesting because what is keeping the government shut down at this point? Well, it's Obamacare subsidies. That's what's keeping that's why the federal government is, shut down. That's why, the military folks are ostensibly not going to get paid, although Trump has said that he's going to find money to pay them. I hope so, since I got 3 kids in that boat. I'm not worried about them. But that would be a huge concern if we're not paying our folks who can't afford it, and yet we're expecting them to defend the nation. So it is a problem, but it's all over Obamacare subsidies? Like, what's that? I thought that ship had sailed. I thought the Republicans capitulated. I thought that John McCain, didn't take that vote back when he should have to end it all at once in Trump's first term. And now we're still back to discussing Obamacare subsidies, something that, there's actually every single day this week, the Wall Street Journal had a big story about the Obamacare subsidies and the politics behind it. And they're quite clear. These are very rich subsidies that the Democrats want to keep. And it feels like the Republicans may be getting boxed into a corner here where in reality they should just pull the plug on them. Well, here is somebody here to discuss more about this. Somebody who really knows everything and studied Obamacare from the get-go is C. Stephen Tucker. He's with Health Insurance Mentors. He's a good friend of mine. And I appreciate his clarity on an issue that could not be more complicated, I think, in all of public policies. Stephen Tucker, thank you so much for joining me.
Good evening, Jeanne.
So you've got Rick Scott writing an op-ed, and Democrats keep shoveling money at Obamacare, saying that they want federal government to keep. He writes. They want the federal government to keep cutting massive checks to insurance companies forever, using your tax dollars to show up the sinking ship of Obamacare. They've even shut down the government to demand it. Obamacare didn't deliver on its promise of health care affordability and stability. President Obama's promise that if you like your health care plan, you can keep it was proved to be a lie. His promise to bring down health care costs was savings of $2,500 every year. That was a lie, too. You have. I love this one from the Unleash Prosperity, Stephen Moore's thing. He says a dozen broken ACA promises, and he goes through each one of them. So what is the deal with these subsidies? Are we were we paying subsidies to people making $500,000 a year?
Not quite that high, but people earning more than 700% of the federal poverty, so close to 800% of the federal poverty. So in plain English, you take a couple who's in their 50s living in Chicago. If they make $195,000 a year, married, filing jointly, adjusted gross income, they will qualify for an Obamacare subsidy, albeit not a large one, but they'll still qualify for it. That is double what was originally granted under the original law before the American Rescue Plan in 2021, and then the IRA, the Inflation Reduction Act, which extended the enhanced subsidies, as they are being called colloquially, that were done under Biden all the way until December 31st, 2025. And then they come to a screeching halt unless something is done, which means that couple who's enjoying a subsidy making $195,000 as of January 1, they won't get any federal subsidy if they make more than 400% above the federal poverty level. That is currently $84,600. So that is a lot less than what they can currently qualify for now. It needs to be understood. This is not the current administration's fault. President Trump has nothing to do with it. These were enhanced subsidies granted under the Biden administration, which were scheduled to sunset December 31st at the end of this year. It is now up to President Trump whether or not he wants to extend them, and I suspect that he will. The question is for how long, a year or 2 years. That's the discussion that's going on right now, because a lot of people who support the president are reliant upon these subsidies because no one is addressing the cost of health care, which in turn is the reason health insurance is so expensive. All they're doing is printing money, throwing it at insurance companies, and calling themselves heroes.
Well, that's what it feels like. And so one begets the other. The more you
Correct.
subsidize it, the higher the cost is. It's just like college tuition.
That's exactly right. And I can't think of one federal subsidy in American history that was ever created that was ever then repealed. Once you turn on the spigot, everybody likes it. They want to keep getting it. And there is a tremendous majority of people who want these subsidies to continue, and that's why I suspect they will.
But it doesn't feel quite fair to people who are having to pay through their employer or employers who are having to pay on the open market for insurance to cover their folks to keep them employed. It just there's so much unfairness here. How do we solve this?
Well, we have to start talking about new healthcare policy. We had a beautiful plan that we put together called the American Healthcare Plan back in when John McCain did his thumbs down vote at 2 in the morning when there was a convenient camera nearby in the Senate. But that was the best piece of healthcare legislation I've read in 30 years. But it was killed by one man at 2 a.m., and that was John McCain's legacy. He killed that bill. So they don't even have to write new legislation, Judy. They just have to start talking about that again and pass it. And then we will actually have a law that will actually result in reducing the cost of health care and in turn the cost of health insurance. And we won't have to keep spending so much federal dollars, $100 billion a year for these enhanced subsidies. We won't need it if we address the crux of the problem. And the crux of the problem is the cost of health care.
And for what do you blame the cost of health care? Is it it's so tech and centered now? Is it the lawfare that goes along with it? Is it a combination of all that? Is it just simply that people are using more of it, or is it also that we're just unhealthy? We're much more unhealthy. I mean, you sell these plans, you know who can get the best rates and who can't.
Yes. Well, I hate to say this because I love the Gipper, one of my favorite presidents in my entire life, Ronald Reagan. But it was him who signed EMTLA, which is an acronym that stands for the Emergency Medical Treatment and Leave Act. And it was written and signed under President Reagan. And it was a sensible law at the time because, for example, there were pregnant women who didn't have insurance, and his law granted that if they went to a hospital, they had to cover them. Well, since then, it's been expanded to anyone who presents with an emergency within 200 feet of any ER, emergency room. It has to be covered. It has to be paid for by the taxpayer. Well, that has grown now to $620 billion. That's what the taxpayer spent to cover largely those who are not here legally, right? Illegal immigrants who use the emergency room for, amongst other things, besides emergency room visits and actual emergencies, preventive care and everything else. That's why when you go to an ER now, it's just packed. You have to wait hours to get care, even though you're a paying customer with health insurance. So it is cost shifting that has been the major driver behind the cost of why healthcare is so expensive. Those who do not have health insurance must be treated under Reagan's federal law, and those costs are shifted to those who have health insurance. And again, $620 billion a year, projected to be $700 billion next year alone. That is the crux of the problem.
This is just outrageous. Okay, so the other part of the shutdown talk, obviously, I think the bigger question is whether or not these Obamacare subsidies for the wealthy continue. But I think the Democrats are arguing, of course, that illegals are not getting subsidized federal health care. That's obviously, from what you just said, that's not true. They are.
Correct. And it's not just under Reagan's law. I'm not just blaming him.
Right.
There are 14 states that consider themselves sanctuary states or sanctuary cities like Chicago, for example, or sanctuary states like Illinois, where those who are not here legally can come and they can enroll in Medicaid. Now, people on the news, many of them on the left, say, well, the law says that illegal aliens cannot get Medicaid. It's the federal law says they can't. That's a true statement. This is precisely why governors like Pritzker signed legislation to use state revenue only, state tax revenue only, to create Medicaid programs to specifically provide health insurance to those who are here illegally. There were two programs. One ran out of money. You and I talked about it before. And there's still one going on now, specifically for those who are here illegally in this country, illegal immigrants, to be on Medicaid because they don't qualify for Medicare. And so under the One Big Beautiful Bill Act, President Trump put into that legislation that if these 14 states, it's not just Illinois, if these 14 states continue to fund these programs using strictly state tax revenue, then the only thing we can do as a federal government to stop them from doing it is to reduce the reimbursement rate we give to those who are legally eligible to get Medicaid. So currently, the federal government reimburses the state of Illinois 90% for those who are legally eligible to get federal Medicaid.
That's the expansion population.
Yeah, it's the expansion population, right?
Right.
So Pritzker does not shut down this program using, again, strictly state tax revenue. Then by June of next year, then President Trump is going to reduce the FMAP, which is the reimbursement amount that the federal government gives the state of Illinois, from 90% to 80% for those who are legally eligible for Medicaid under Obamacare expansion. That will cost the state $800 million every 12 months. He's not just doing it in Illinois, he's doing it in all the other states. This is the other part of the argument. Democrats want that program to continue. They don't want anybody stopping that from happening. That's the other part of the argument.
Wow. Okay, I just learned a lot in a short 15-minute discussion with you. And I'm sure my listeners did too. So there you go, folks. Those are the arguments being played out. Those are the reasons that the federal government is shut down at this time. And maybe you don't care. A lot of people don't really interact with the federal government. They don't have a need to. But long term, it's not good. So I thank you so much, Tucker, for coming on and explaining this to my audience and adding some clarity to a very complicated topic.
Yeah, so they can follow up with all the facts and data they need at cstephentucker.wordpress.com. All the data is there.
Okay, that's awesome. Thank you so much. This is The Real Story. This is The Real Story with Jeanne Ives. We'll be right back after this break.